Hi, Candace.
Hi.
Hi, Dr. Coomer. Hi, Celia. How are you both?
Good. How are you?
Doing good, thanks. Thank you so much for joining me. I really appreciate it.
Thank you.
Dr. Coomer, what is the Bc5 Project?
So the Bc5 Project is a program where we're empowering and educating women and advising them about the treatment options that are available to them. So really broadening their awareness. Women need to know that not one size fits all when it comes to their treatment options. And with 1 in 8 women being diagnosed with invasive breast cancer, we want them to know that there are various different options for them.
And are there any underutilized options women should know about?
One of the most common underutilized options is brachytherapy. It's a 5-day treatment of radiation treatment. It's a targeted dose that's given within the breast tissues. So unlike whole breast radiation, which is 6 weeks of treatment, the skin and chest wall are not exposed to radiation treatment, and they also don't get the fatigue that comes along with that. So it's not only shorter so that they can get back to their lifestyles, whether it's work, family, and friends, but in addition to that, really has no side effects.
And can you both offer some thoughts and advice for women who have recently been diagnosed with breast cancer?
Well, definitely speak to your doctor about your options. The Bc5 Project actually did a survey which indicated that women really do rely on their doctor's recommendations. And of the women that they surveyed, less than 7% of the women had actually heard about the treatment option. And of the women that were surveyed, 76% of them said they would have liked to have known because they would have been candidates for this treatment. So do your research and also speak to your physicians about what your options are, especially when you've been diagnosed with early stage breast cancer. And Celia has also actually underwent brachytherapy, and I'm sure she has some advice to offer patients.
I underwent brachytherapy in July. It was a 1-week treatment. Treatments were twice a day for 5 days, and I had no side effects, no pain. It was fine for me. So I would advise women to do their research and with their doctor decide on this option.
And how are you feeling today, Celia?
I feel fine, thank you.
Oh, good. And do either of you have any additional information you'd like to share with us?
Well, one of the things I think is important to highlight about 5-day radiation is the future options for patients if they've undergone it. So patients who have whole breast radiation, if they develop a recurrence or a second breast cancer, will likely need to undergo mastectomy because they can't have radiation again. But a woman who's done the 5-day radiation treatment actually may be able to do a lumpectomy and radiation treatment should she develop a recurrence or a second breast cancer. So it certainly opens up the doors for patients in the future.
And where can viewers go for more information on brachytherapy and the Bc5 Project?
They can go to our website at bc5project.com to find out more information and what their options are, and also how to discuss it with their physicians.
Well, thank you, Dr. Coomer. Thank you, Celia, for taking time out of your busy schedule to speak with me this morning. I really appreciate it.
Thank you, Candace.
Thank you.
Thank you. Have a good afternoon.
You too.
Bye-bye.
Bye.